and a diminishing happening in British Columbia and in the Maritimes, Saskatchewan and Manitoba as well. So there's a balancing that kind of seems to be going on. The Prime Minister today as well saying there's a leveling of the curve going on in some parts of Canada, but not in those clusters, not in places like Montreal, not in Toronto, not in major urban centers because of the population density. The projections are interesting, though. They say Canada could have as many as 68,835 cases by May the 5th. That number could, of course, be much lower. Remember, we're closing in on 50,000 right now. Dr. Sumon Chakrabarti is my guest. He's an infectious disease specialist joining us today from Mississauga. He was listening in to some of what was happening in Nova Scotia, following it all today. Always lots to cover, of course, Dr. Chakrabarti. Good to have you with us to help make sense of it, cut through the noise here. When we hear Canada is sort of leveling off in certain parts, that's good news, correct?
Well, yeah, it's great news. And I mean, this is demonstrating that what we've been doing painstakingly for the last 6 weeks has worked. It has an effect. We still need to go for a bit longer in terms of this level of restriction. But yeah, I mean, it's good to see these curves leveling off. It's still a little bit longer to go here in Ontario, but you know, a lot of what we're seeing now is that last surge of long-term care facilities and their patients coming into the hospitals. But for the most part, the trend has continued to decrease.
One of the things, speaking of Ontario, that's interesting, and I wonder whether you think it's a cause for concern, is that there still seems to be 50% or more of each number of cases every day in Ontario, 50% or more are community transmission separate from long-term care facilities. So it's still spreading within the community. What do you make of that?
That's right, and that's expected. We still expect to see at this point. We are at the, at or just after the peak of transmission. There's still going to be more of a plateau peak, as I call it. It takes several days for this to slowly start to come down as a trend. But I do expect that to happen at some point in May, likely within the first couple of weeks. And that's when we can see that sustained decrease in cases. And then we can make decisions on opening up the province.
Okay, let me ask you about Quebec today, moving forward with a pretty bold plan. Retail stores outside of the greater Montreal area, there's about 3 million people or so in that area, but outside, they will allow them to reopen within a week. In fact, less than a week, Monday the 4th. And then in the rest of the province, so that Montreal area, it'll be the 11th. And there will be some, of course, specifications. Stores have to have doors to the outside. This does not include shopping malls, but also the construction sector and the manufacturing sector in Quebec, also on the 11th of May. Your read, too fast, too soon, or not?
I do think it's a bit fast, and I think that it's really important to have a phased in, a staged dropping of these restrictions. What I'm getting the impression of in Quebec is I understand the need to want to open up the economy, but I fear that if it happens at this rate, you're going to see a resurgence in having to tighten those restrictions once again.
It's interesting, too, to sort of think about what Quebec said. And let me just paraphrase. They said, look, this is a controllable risk. There's no way we're going to get rid of all the cases. Those cases will be with us until we have a vaccine. We can bring the cases down, but we have to balance what's happening in terms of new cases with what's going on with people stuck at home 6, 7, 8 weeks, the mental health issue, the damage to the economy. So then it becomes this sort of calculated risk almost where they want to reopen. They're trying to level with people and saying, look, if you're thinking the case level is going to go to zero, forget about it. That's not going to happen. But we do have the capacity in our hospitals and our ICU units to manage it.
That's a very good point. And they may be right, and it's going to kind of play out in the next couple of weeks. So when we look at that, I think it's very important that while they do that, they have to have ongoing, very, very extensive testing, early identification, and contact tracing to be able to show that, look, if things do start to resurge, they have the ability to clamp back down and they have the capacity to do it. I am skeptical, but I'm very, very happy if I'm wrong about it.
Dr. Chakrabarti, I look forward to further conversations. In the meantime, thank you for this.
Thanks for having me, Todd.
It's always great to talk to medical professionals about this kind of stuff, especially folks who, of course, know about infectious disease.